Hello, everybody, and welcome to our webinar session on the Planetary Health Toolkit for Nurses. And many thanks to Nursing the Future for giving us this opportunity and how appropriate this is in our presentation today of a tool that we hope will be a stepping off point for you in thinking about how nurses can learn about the challenges we are facing now and in the future in the healthy functioning of the Earth's systems, and hence the health of all of those who live on this beautiful planet. And as you will hear, nurses are key in taking action on addressing these challenges in order to protect and preserve human health and well-being and the health and well-being of all living creatures on this planet. We would like to start off by acknowledging our partners in this project, the Canadian Federation of Nurses Unions, who funded the creation of the toolkit, and thanks to other members of the team who are not with us today, but all worked so hard to put this toolkit together and whose names can be found in the document. We have no further disclosures to make. And we would just like to take a brief minute to acknowledge that Canada's healthcare systems are built on the traditional territories of over 630 Indigenous communities across this country, each with its own languages, its own laws, ways of being, and cultural practices. And my name is Fiona Hanley. I'm a nurse educator, longtime member of CANE, and co-chair of our education committee. And I'm joining you today on the unceded traditional territory of the Kanien'kehá:ka Nation. Tiohtià:ke or Moonian Montreal has long been a place of meeting and exchange between nations. And we recognize the Kanien'kehá:ka of the Haudenosaunee Confederacy as guardians of the lands and waters. We also recognize that the relationship between nature and people is central to the identity, culture, resilience, and survival of Indigenous peoples who have lived and cared for this land for thousands of years. This understanding is also essential to a healthy and sustainable future. Our health and that of our planet are inextricably linked.
Hi everyone, my name is Émilie Tremblay. I'm a PhD candidate at the University of Ottawa. My thesis subject is the impact of the climate crisis on the mental health of young adults. I've been a member at CANE for the last 5 years, and I'm now president-elect. Today, I'm joining you on the unceded territory of the Anishinaabe Algonquin people.
Hi, everybody. My name is Joanna Law, and I'm a senior practice consultant with my local health authority and a member of CANE. I live in Treaty 6 territory and within the Métis homelands.
So maybe you're wondering, actually, who are we? Who is the Canadian Association of Nurses for the Environment, or CANE? We are a non-profit group which began back in 2008, initially as a group of nurses from across the country who were invited by the Canadian Nursing Association to participate in a centennial year project at the time that was focused on increasing capacity for nurses in addressing environmental health. The Environmental Reference Group met for about a 2-year period to create different tools and resources that nurses could use to both learn about and to think about how to integrate environmental health, climate change into their practice within the healthcare system. And as the project ended, a small group of people felt that really this was only the beginning of the work that there was to do, and so founded the group, which has since become CANE, the Canadian Association of Nurses for the Environment. And so from this small, very committed group, CANE has become a very dynamic organization that's increasingly recognized for expertise in planetary health, in climate change, with members across Canada, almost all regions, and multiple collaborative projects at regional, national, and international levels, with the organization sharing a vision for planetary health equity, cutting across all domains of nursing practice, policy, research, education, and administration in Canada and globally as well.
Humankind faces a triple threat of interconnected problems: climate change, pollution, and biodiversity loss. Each has its causes and effects. They are interrelated and human-caused, and each must be addressed to have a viable future. Due to human-driven climate change, Canada is warming at about twice the global rate. Climate change affects the health of Canadians directly through exposure of extreme heat and extreme weather events, poor air quality, and infectious diseases, and it also impacts health indirectly through disruption of social, environmental, cultural, and economic pathways. Biodiversity is fundamental to human health. Changes that negatively affect ecosystem functioning can result in human health threatening outcomes, such as impacting the availability of fresh water, food, and fuel sources. These are all necessary for good human health, the control of pathogens, and productive livelihoods. In 2019, pollution was responsible for 9 million premature deaths globally, the most significant environmental risk factor for premature death and disease. This corresponds to 1 in 6 deaths worldwide. Air pollution is responsible for at least 1.8 deaths globally, 1.8 million deaths globally. Research studies reported that many young Canadians' mental health is affected by climate change daily. Some of you might have heard of various words that describe emotional responses to the climate crisis. Examples include climate grief, eco-anxiety, solastalgia, just to name a few. These climate emotions demonstrate how psychological and emotional well-being is linked to the environment and how climate change can exacerbate these responses. These emotional responses can be triggered by direct impacts, like firsthand experience with a climate event, or indirect impacts, like seeing a climate event happening worldwide and you see that on your social media feed or on the news. Emotional responses to the climate crisis are rational responses to a serious threat or a loss. They are not made to be fixed. They are not a pathology or a weakness. To grieve means we must care about something and be connected to something that is beyond ourselves. It's a good thing. Taking action has shown to help with these psychological responses. Types of actions vary from speaking up about your climate concerns with colleagues or friends to taking direct action through community initiatives such as increasing city bike lanes. Today, we want to introduce you the concept of planetary health as a response to the combined ecological and existential crises. Planetary health offers new understandings for health professionals regarding our relationship with the natural world and the importance of protecting and preserving nature for the benefit of all life on Earth. What benefits the environment generally benefits human health. Planetary health aims to safeguard human health and the natural world by addressing climate change, pollution, and biodiversity loss, the triple threat.
So you might be asking, well, what do nurses have to do with this? It's actually crucial for nurses to be involved in promoting planetary health and climate change mitigation. Nurses occupy the right positions, have widespread influence, and possess the skills to create meaningful changes. So first, nurses play integral roles at all levels of the healthcare system, from bedside care to education to policy advocacy. Nurses are present in every aspect of healthcare and are uniquely positioned to facilitate change. We're really a driving force that brings together and mobilizes interprofessional teams, technology, supply chains, and community resources to provide optimal patient care. So we can also be the driving forces that brings these elements together to work towards planetary health. We can advocate for sustainable practices, influence organizational and health policy, and ensure that planetary health is part of the conversations we have within our institutions. Secondly, nurses are privileged to have contact and influence with people throughout all walks and stages of life. Whether we're caring for newborns, the elderly, or communities impacted by natural disasters, we build trusting relationships. This gives us a powerful platform to educate and empower individuals to understand the importance of planetary health, how it directly impacts their well-being, and how to manage these impacts. And lastly, nurses are equipped with incredible knowledge, skill, and experience, which make us really well suited to promote planetary health. We understand the connections between environmental factors and health outcomes at individual and population levels, from preventing climate-related disease and illness to promoting green healthcare practices. We have the expertise to influence and implement changes that protect our patients, our communities, and our planet. But you might be thinking, well, I'm just a new grad or a novice nurse. I'm not an expert. Being a new grad can actually be pretty overwhelming. The demands of the job can feel like a lot to manage. You are, learning a new role, taking on new responsibilities, making connections, and a lot of the time just figuring out who is who and what is where. But don't let that discourage you from thinking long term. Changes towards a healthier planet don't happen overnight. Your career is just beginning. Each step you take in learning, educating, acting, and advocating helps. Even the smallest drops of water in the ocean creates ripples. Take the time to make connections with work already being done in the field. You don't have to start from scratch. There are many initiatives focused on planetary health that you can support, learn from, and be a part of. Collaborating with colleagues, mentors, and organizations can give you access to the resources and guidance you need to help make an impact. And what I think is very, very important is that you value what you uniquely contribute as a student or a new nurse. You have clinical knowledge, empathy, and a perspective on health that is unique and valuable. Your contributions, whether through direct patient care, patient education, or advocacy, are essential in the global effort to protect our planet and our health. Now, you probably saw there was something about a toolkit in this presentation, and we are here to talk to you about this nursing toolkit for planetary health. This toolkit proposes planetary health as a vital response to the ecological crisis we're facing, and it serves as a guide specifically for hospital-based nurses. It's available both in French and English, and there's a condensed printable version available, as well as the full digital version that has links to additional resources, and it's regularly updated. The primary focus is on climate change, which is really the most urgent threat to planetary health right now. The toolkit's designed to address the urgent need for environmental sustainability in healthcare. It aligns with planetary health goals and initiatives and empowers nurses like you to take meaningful action on climate change and health. It encourages interdisciplinary collaboration, recognizing that working together is key to creating change. By enhancing your knowledge on environmental health issues, the toolkit promotes holistic approaches to patient care, supporting not just individual health, but the health of our planet. You'll find practical tools for patient education and guidance on advocating for sustainable health practices in healthcare settings. In short, this toolkit equips you with the resources you need to make a real impact in promoting both planetary and patient health. What I really like about this toolkit is it offers something for everyone. Nursing is an incredibly diverse profession. Nurses are in different areas of practice. We have different interests, strengths, roles, and levels of knowledge about climate change. Some of you may want to learn more about the scientific background of climate change and its effects on health, while others of you might be seeking more guidance on how to integrate that knowledge into your nursing practice, whether through direct patient care at the unit level, or even engaging with the healthcare system at an institutional or policy level. This toolkit is designed to meet you wherever you are in your journey. There's plenty of opportunities for you to get involved and make a difference. So we know that nurses tend to be very practical people, and we're always looking for concrete ways to make a difference. And so this section of the toolkit offers very practical ideas on how to incorporate climate change considerations into the nursing process, from patient assessments and teaching to nursing interventions and even planning for discharge. The toolkit prompts you to ask key questions when you're working with patients and families. Consider the specific risk factors related to age, health condition, developmental stage, or vulnerabilities tied to where your patients might live, their occupation, or life circumstances. The toolkit outlines some ways climate change interacts with these factors and influences health outcomes. It offers guidance on how nursing interventions can be tailored to address the potential impact of climate change on your patient's health, what teaching might be required, and what considerations should be taken into account for discharge and follow-up.
Thank you, Joanna. So maybe just to go into a little bit more detail and to add on to what Joanna has mentioned in terms of the individual actions and what nurses can do. And so this first section really is about how we bring the knowledge about climate change into day-to-day practice, really in working with patients throughout the patient care cycle from admission to discharge, and in thinking about all the impacts that we can make, that we tend to make in as nurses on the environment and health, and so hence on human health. And clinical actions include such things like Joanna had mentioned as assessing for climate-related health risks or vulnerabilities, potentially education for patients and even colleagues as well too on links between climate and health, helping to assist patients in preparing for possible climate events depending on the region of the country where people happen to be living in, and also considering their health conditions, their stage of life, or who they live with, what their particular surroundings are. Perhaps it might be assisting patients to recognize opportunities that they can reduce their own contributions to the climate crisis, informing patients about resources in their area, including things like air quality advisories or emergency preparation in case there might be a major climate event such as a wildfire or a flood, excessive rainstorm, some other kind of major weather event, for example, or a heat wave. The nurse could also provide information on medications, whether it's the storage of medications or how those medications might be affected by, for example, excess heat, what kind of impact it can have on managing their health condition, whether it's also thinking about what kind of equipment or supplies that's needed specific to people in relation perhaps to their discharge home. So there's plenty of information and resources concerning issues like glove use, for example, disposables, and even actually anesthetics, which are in and of themselves important contributors to healthcare's carbon and environmental impact that sometimes people don't actually think about. The photograph that you see here is of a person using a powder-based inhaler, which is activated by the person's own breath instead of the propellant in metered dose inhalers or MDIs that are paradoxically, very powerful greenhouse gases. And so the toolkit offers guidelines in not only understanding the impacts of MDIs, but also how nurses and other healthcare providers can reduce the carbon impact of asthma treatments, and linking to resources such as the really excellent resources from Cascades Canada's, who have made very clear primers on this subject. There's also information about the Quebec Sustainable Healthcare Network campaign on appropriate glove use, knowing that there's a lot of confusion about appropriate glove use. And it also offers some examples of different initiatives in hospitals across the country. So at a unit level, this section looks at unit level initiatives, such as thinking about, well, if I want to create a green team, how do I go about actually doing this? How do I put this team together, and who should be part of this? Thinking about waste management, that's often something that nurses are very concerned about. How do we think about our own contribution in reducing waste management? How can we reduce waste in the unit itself? How do we manage our waste better? And that might include things like pharmaceuticals. It could mean personal protective equipment, PPE. It might mean plastics or single-use items. Some holdovers from the pandemic, of course, where we saw an astronomical increase in waste and very much increased current concern from nurses about the issues of waste, because they were seeing these kind of things on a daily basis. But it did leave some insecurity that has been a bit of a handover from a holdover from that. With concerns about the protection of healthcare workers and patients. How do we do this in a way that's going to be protective of healthcare workers and patients without also having a harmful impact on the environment? So we know, of course, that our actions directly impact the environment. So it's very important that we understand different policies on what is the waste management in our setting. And even the toolkit will give information at a provincial or territorial level, how to find out about that in order to ensure the safe disposal of waste. And this picture here is, you can see, is from the Rocky View Hospital in Calgary, where they actually use some proper clear signage to indicate where items should be provided to patients. One of the other things that we might think about is when providing direct care to patients, nurses are involved in choosing sometimes which products to use and how many. and what kind of things we might bring into a patient's room, and even how they're disposed of. So even though you might be following protocols on waste management, some things might be actually disposed of inappropriately or unnecessarily, or even bringing extra items just in case, bringing them in our pockets, and they ended up being discarded without actually being used. So sometimes that might be because of old habits. It might be just in things of inconvenience, or maybe even a lack of awareness of policies that have been possibly updated or changed. So sometimes it also might be things like throwing away the entire contents from a dressing change into the biohazard bin, when in fact only the initial dressings next to the patient's skin require disposal in biohazard, while the rest could actually go into the regular garbage, and some packaging could be actually recycled, such as the cardboard, thin cardboard or paper that are often quite easily recycled. I'm going to hand over to Emily for a systems level.
Finally, the toolkit also contains information and ideas for joining with others and those who wish to engage with management to address climate change hotspots and create different institutional policies. Actions can vary from promoting energy conservation to transforming food systems and alternative transport, supporting sustainable supply chains, reducing food waste and meat consumption, increasing plant-based foods, etc. The section provides sample emails to help you communicate with hospital management, which can be a great starting point if you don't know where to start. Additionally, this section offers information on participating in actions such as the Canadian Coalition for Green Healthcare's Green Hospital Scorecard, or collaborating with local organizations to tackle issues in your region. Since nurses are often very busy, frequently short-staffed, and engaged in multiple work responsibilities, we advocate for establishing roles or teams of nurses specifically focused on sustainability and cooperation in designing and implementing effective solutions. Nurses increasingly encounter disasters or severe disruptions due to climate change, putting hospitals and healthcare systems at risk from extreme events. Noteworthy severe events in 2024 include the Calgary hailstorm, remnants of Hurricane Debbie in Quebec, and the Jasper wildfire in August, flooding in the Greater Toronto area in July and August, and severe storms in southern British Columbia in October. Although the toolkit does not devote much time to climate-induced disasters, such as floods, wildfires, and windstorms, these are a growing reality that nurses must deal with. Nurses have a history of taking leadership roles in crises dating back to the early days of nursing. They jump in when many others flee, and they might have to assume roles outside of their usual scope. The toolkit does provide information on medication storage and supplies during climate events. It also, ensures that people have emergency supplies, so it does mention that. And it also mentions, getting to cooling centers during heat events. Our general recommendations when we're talking about disasters is that nurses require training, support, and resources to respond effectively and need advanced crisis resource management skills education. Therefore, we encourage connecting with your organization to understand disaster planning and your potential role, as this can vary from region to region based on their geographic vulnerability to climate change. We also recommend to be prepared with your family in the context of where you're living. During the COVID-19 pandemic, we saw the importance of resilient health systems and supplies like PPE to protect healthcare workers and adequately answer to the population's healthcare needs. The Lancet Canada Countdown calls for urgent investment in resilient health systems and adaptation to mitigate disruptions in the face of climate change. We've included the QR code to access their 3-page document titled 2024 Climate and Health Policy Priorities for Canada, which goes into detail about their 3 policies and their 3 priorities. Our key messages today are that climate change is already having major impacts on human and planetary health. Planetary Health offers new ways of understanding human-nature connections. Nurses can act on multiple levels to address climate change in their practice, whether at the individual level, unit level, or institutional level, or all 3. We want to stress, too, to never underestimate the impact of even a small contribution over time. This is a reminder that the toolkit is available in English and French, and that the full digital version includes links to additional resources and information. The resources are updated, and the digital version will be adapted over time to include new resources and information. We want to thank Nursing the Future for inviting us to speak on our Nursing Toolkit for Planetary Health and allowing us to connect with new graduate nurses. And we have also included here the link to our association for those who want to join us. Thank you so much.